Hi, I'm Michael Battelle, President and Founder of the Fatty Liver Alliance, for another episode of FLA on the Road, and this time we're in Washington, D.C. at AASLD 2022 with a very famous Tim Jobson who came all the way from Somerset, UK. He's going to share some really leading edge work that they're doing to help identify patients as early as possible in their journey. Let's hear what you have here on your poster.
Thank you, Mike. So today we're presenting a new risk assessment system with a cumulative liver damage index to identify patients at risk of chronic liver disease. And what we've done in Somerset is we've imported all the data from our laboratory system going back nearly 20 years on about 500,000 patients, and we have about 200 million blood tests there that we can analyse. And the key thing is this is a case finding program, so we're trying to identify patients using existing data sets, using existing lab data. Currently, all the risk scoring systems in liver disease are based on a single point in time, so the FIB4 is just what you like today. In clinical practice, we tend to want to look at information spread over time. And if your blood tests have been abnormal for a long time, you're more likely to have accumulated damage to your liver. So we created the cumulative liver damage index, which is essentially just the area under the ALT chart there, and combined that with perhaps a trend line in platelets. So if your platelets are falling, again, you're at higher risk of liver disease. And what we see here in the results is we can calculate that area under that curve for about 1/3 control patients and nearly 2,000 with liver disease. The blue line represents the control patients and the red, the liver disease patients, with a long tail out to the right represented by this bar here. So there's a clear shift to the right and a clear ability of this new index to predict liver disease. And that's coming out with an odds ratio of something like 19. So it's an extremely powerful tool for identifying liver disease. Furthermore, we looked at population platelet trends, and for patients with advanced liver disease, with F4 fibrosis we call it, there's a shift to the left. So these patients tend to have a negative platelet trend. And combining those factors together, we're coming out with an odds ratio that's really high, so nearly 25 for predicting advanced liver disease. So the underlying story is that using a longitudinal analysis is a really powerful way of identifying patients, potentially not yet known to our service, who need to come in for treatment of their underlying liver disease. Thank you.